So we're going to talk about NurseView in this video. It's really simple and easy to use, but it's underutilized. This is where you're going to find information on your vitals, your labs, your intakes, your outputs, any pertinent documents or clinical notes or progress notes, patient education, and so forth. Now, if you'll notice right here, I have this auto hide. I'm going to hide these bands over here on the left hand side, and we're going to move over and move that over and have more room to play around. So right here I have what is called a workflow, and I can create this workflow however I want, and then it'll be in this order on the right hand side. So if I wanted to grab micro, I can move micro up and I can move micro down. I have mine in the order that I would use them, which is vital signs, labs, intake, and documents. And then I could even move order profile up, and if I hit order profile, all my orders will be here. Even if I have comments, I would see a little comment box right here, and if I click on that, I can actually see all the information on that order. So this is a nice functionality, and if I can't see my comments, I can highlight my comments, and then I can see them. So you can also use the headers. So if you ever see headers in any of the sections, you can click on those headers, and I could have the start date from the newest, or I could have the start date from the oldest. If I'm up here at vital signs, I could see my vitals. I don't have any in here, but if I did, I could click on them. It will trend out my vitals over here on the right hand side, and I can filter out to the last 48, 7 days, 2 weeks, and I could go back even the last 3 months, or I could go back probably even further. Same with the labs. You can go back up to 2 years, I believe, so you can go down here to 2 years and see more on the labs. Now, if staff show you a different way, which is if I go to labs, it will take me to results review. That's fine, but that's probably not the most efficient way to find your labs. You would see labs here, and you would review your labs in here. Otherwise, if you hit this little house right here, it's always going to take you back to the NurseView. So each header is clickable and linkable and linked out to something. Intake and output is going to be linked out to our charting. For intake and output, it actually takes me to vital signs, but that's where I would look. Is underneath that, I would look over at the intake and output. But documents, you'll see people go to what is called clinical notes. If I click the documents header, it takes me there, but it's quite clunky to look at clinical notes. So if I hit this house and I'm on documents, I can look up the last 6 months of notes. So if you look here, I have an H&P. I could click on that, and it's going to show me that H&P on that patient. If I want to find something specific on a patient, such as dialysis, I could hit chart search right here. And this is an easy way to find notes and to find nurse charting. If I hit this chart search right here and typed in dialysis, and I hit search, anything with the word dialysis is going to be in here. So now I can find a nursing note right here that has all of this information related to dialysis. So playing around with this will give you quick, easy ways to find information. You do have a suggested patient education, and you can click on education from here and print it, or remove it, or modify it, whatever you want to do. But you'll have suggested education based off of specific disease or diagnoses.